In a largely criticized move, Guam is left out on the $50 billion Rural Health Transformation Program, a federal grant that's expected to open up in mid-September to rural hospitals across the nation. The grant was authorized by the GOP-led One Big Beautiful Bill Act to address the significant reductions to Medicaid spending. The Congressional Office budget estimates that those cuts will total $911 billion over 10 years, and 10 million people may lose coverage by 2034. In early August, Centers for Medicare and Medicaid Services Administrator Dr. Mehmet Oz went before CBS's News' Face the Nation.
They'll get the applications in early September. The money is designed to help you with workforce development, right-sizing the system, and using technology to provide things like telehealth that can change the world.
Department of Public Health and Social Services Director Teresa Arreola says she first heard of the grant through federal partners.
Really, they just said there's this grant that's going to come out, and the NOFO, which is the Notice of Federal Funding Opportunity, will come out, and everybody should look out. And then they started planning on informational webinars so that states and territories can please get to know more about what the application requirements is going to be. And that was just late August.
It was through a source in D.C. she recently found out only the 50 states are eligible. The District of Columbia and U.S. territories are not.
My reaction was a deafening, oh my God. Because really, this grant, this Rural Health Transformation Grant, was what I saw as the makeup, if you will, for public health, some of public health's grants that were removed throughout the year from HHS. And we were all, including the states and territories, when in those early morning meetings, were really looking forward to it because it was going to help us make whole what happened earlier April and May when certain grants were removed.
She immediately brought it to the administration's attention during the Labor Day weekend. From there, Lieutenant Governor Josh Tenorio criticized Guam's exclusion at a federal territorial meeting in Washington, D.C. last week.
This denies us access to programs that would support the acquisition of electronic health records and health information exchange systems that are essential for modern healthcare. We urge action to fix this exclusion and recognize also that there are pathways for closer collaboration among the territories in pursuing modern solutions for healthcare technology to maximize the provision of healthcare to all of our island residents.
But in response to media reports and criticism from island leaders, Congressman James Moylan says Guam was not excluded from the grant due to, quote, oversight or neglect. He says the grant was created to address Medicaid reductions that apply only to the 50 states, adding Guam and other U.S. territories are not subject to those reductions and therefore were not included in the specific funding stream. Moylan is working on drafting legislation to establish a parallel fund for territories modeled on the grant. The delegate also highlighted the long-term development of a broader initiative to address Medicaid equity for the territories, what's called the Access to Medicaid for Our Territories Act. Meantime, the public health director shares her disappointment that Guam was left out in the first place.
That's a lot of millions. I would be happy if I just got a handful of those millions for Guam. And it's unfortunate that we were not included in this initial rural health transformation program. Guam, of course, is all rural. We are considered rural with our federal partners in many other ways, and we've never been not rural as the federal government sees Guam.
Guam Memorial Hospital Authority Administrator and CEO Lillian Perez Posadas echoes her sentiments, speaking out on how it could have helped the island's underfunded public hospital.
The $50 billion, if we could benefit from that, that will help us move forward and even elevate the availability, the accessibility of health services to the people of Guam. But unfortunately, if we're not going to have any of that funding source, then we'll have to find ways, other funding sources, to make sure that we continue to provide and, make the care accessible and available for the people of Guam.
Matsuki Hirayama, KUAM News.